I just want to talk about anxiety. Remember, we talked about with chronic pain, there's lots of anxiety. We have anxiety for every possible reason there is. I mean, anxiety is necessary for survival. If we didn't have anxiety, we wouldn't survive. So anxiety creates a feeling of vulnerability and helplessness. And so we really hate that feeling. So we'll do almost anything we can to avoid anxiety. So we'll avoid situations that cause anxiety. We'll create situations that allow us to control anxiety. We get into structure situations. In other words, the antidote to anxiety is structure. So we'll get rigid thinking systems. We'll do lots of things we can do to control situations in our thinking to decrease anxiety. So the antidote to anxiety is control. When we lose control of the situation that causes anxiety, we become angry. So when you become angry, it gives you a feeling of power, which covers up the feeling of anxiety. But at the same time, you have this feeling of power that anger actually takes these anxiety-producing neurologic circuits and fires them way up. So you can decrease your anxiety by 50-60%, but if you don't actually understand that the source that fires these circuits back up is anger, you're in trouble. So there's a genealogy of anger that's really important to understand. So you have a circumstance that you blame, and then you're a victim, and then you are angry. So there's two types of anger. There's what I call perceived anger and real anger, or real victimhood. So in other words, perceived victimhood is somebody didn't invite you to a party, or they hurt your feelings, they cut you off in traffic, whatever. So you'll have a circumstance that you're blaming, you're a victim of that perceived circumstance, and then you're angry. So real victimhood is somebody assaulted you, they robbed you, they beat you up, they hurt you. So you have a circumstance that you blame, and you're a victim, and you're angry. At the bottom of the cascade is still anger. It has an equally damaging effect on your psyche, still fires up the anxiety-producing circuits. So with chronic pain, the difference between real anger and perceived anger is that real anger is a lot harder to let go. Chronic pain is real victimhood. You have a very unpleasant stimulus coming at you every day. You're being bounced around the medical system. Nobody believes you. You're labeled, you're trapped. The frustration levels become intense, incredibly intense. So if you think in terms of neurologic circuits and repetition, these anxiety circuits become very strong. The anger drives these things very hard. And the problem with chronic pain is not only is it real victimhood, it's persistent every day. It's probably one of the most unpleasant experiences in the human existence. And it doesn't stop.